Zoom, zoom, zoom.
Is it better now? Is the echo still there?
I hope not. I can't hear myself yet for now, so I think it should
Okay.
be fine. Let's hear from others. What do they say on the page? I'll check if
Yeah,
they
also
something.
still waiting for them to say something. Guys, please comment if you are hearing us properly. There's no echo. My voice is not low, so we can continue. They're
Yeah,
saying
they are
no more
saying no
echo.
more echo. It's 100%.
Yeah, so now we can begin. Please bring back your friends. Share the broadcast, share the live, take somebody to come watch it. So we're gonna begin now. I was saying that we've all seen you from social media. We hear about you in radio interviews. So for the people that do not know who we are speaking in, let's hear from you tonight. Who is your speaking Gemma?
Yo, thank you very much once again, Rotondo, and greetings to everyone there on the page. It's really interesting and it's very beautiful to be here. I feel very much privileged, actually, to be the first one to be invited here. I'm the first one, right?
Yes, you
So,
are.
yes, I'm really privileged to be here today, and I hope it's going to be worth your while and everyone as well that we are here gathered at 8 o'clock. It's what time now? It's 8:30. Yeah, man. Osianda Sia speaks in Madlogovu. That's me. Um, I'm just a young nurse, I call myself. I'm coming all the way from KwaZulu-Natal. I've been in Pretoria now for how many years? 11 years. Came to Pretoria in 2011 to begin with my degree in nursing science with one of the top universities in the city, not only in the city, but in the world. So I did my degree for a period of 4 years as required, and thereafter did my ComServe. So while I was doing nursing, actually, I realized I also had passion for public speaking. So I thought, why not combine these two? When I was invited in 2016, I was invited in Nurses Day celebration, 12th May. So in the city of Tshwane. So I was given a chance to give a speech. So I thought, if I can be a nurse and also be a speaker, why can't I just do both? So then that's how the Sia Speaks name came about. So then I'm a nurse who is a public speaker, and also I facilitate events. I MC some of the very big events of any caliber. As long as there's not going to be alcohol involved, I'm all fine. So I do that, and then I'm also a nephrology nurse specialist, and I have a great passion for young people's development. I have great passion for infection control in nursing and all other parts of health spectrums or spheres. So yeah, that's what I do. But of all other professions, of other specialties in nursing, I love nephrology. That is where my heart has been taken for the past years, and I've devoted my life into helping patients with kidney disease or other complications related to kidney disease. So I think that covers who Sia Speaks is, unless there are questions around there.
Okay, now it makes sense. I've been wondering where is the name Step Speak come from. So now it makes sense. Now it
Yeah,
makes
yeah.
sense.
And I hope I never really leave the name. I just live up to it and Sia Speaks and keep on speaking. When it's come to only being a Sia Speaks, I don't only speak for myself. Also, as nurses, we are always told we are advocate for patients. So I always advocate for patients who are vulnerable, or even other patients who are not as vulnerable, to say, how do we represent them well? How can we make sure that patients are given best care in our country? So Sia Speaks also goes in those fields to make sure that I'm an advocate for patients. I speak on their behalf where they cannot reach. I'm always trying to make sure. And I'm also a speaker for nursing. I model the profession. Wherever I walk, I want the person to see that this is what a nurse should be, or what I would admire nurses to be, a lot of them. So I speak volumes for the profession, for myself, and also for patients.
Speaking of patients, people usually say that nursing is a calling. Some they say that nurses are trained. So what is your take on that? Why did you choose nursing specifically? You could have been a lawyer, an engineer, but why nursing?
A very interesting one. You know, that the debate around that one of nursing being a calling and also people going to getting trained for nursing. It's a very diverse topic, and I always laugh when I hear people debating about it because we can all come from different spheres of different positions or shapes to try and raise our opinions with regards to nursing being a calling or not. And I believe that nursing being a calling part came from the past. We have to remember that in the past, the first nurse who was prominent in the past was Florence Nightingale. And when she would describe nursing in her way of describing it, it was a matter of nursing is a calling because of she would go and gather a few ladies who were from the Catholic Church to go and assist soldiers who were injured during wars. And then they will be from that perspective of a church to say it's a calling when you are joining into it. And then, of course, everything evolves. So nursing itself also has evolved over the years that we had to now change, and then you have to go to school to be trained, And there are people who still think nurses are not as trained to really offer the best care as possible. When you are a nurse, when you say nursing is science, they look at you and think, what do you mean nursing is science? You understand? It's very diverse. So for myself, growing up, my grandmother was a nurse. She was working in theater. So every time she would ask me to bring her lunch during lunchtime around 12, 1 o'clock. I was very young back then. I was about 6, 7, 8. So when I would be taking lunch, going to give the lunch at her workplace, I would see her there in theater with her colleagues, and then I would see how beautiful the hospital would look, how passionate they would be running around in theater. Sometimes I would wait for an hour because I had to just let them finish with their procedures. And then when she comes to me, she'd be like, sorry, we were saving the lives of patients. And at times when they would have campaigns, I would go there also and look at what is it that they are doing there. And then I developed love for this. I loved what they were doing all the time. And then over the years, as I was growing, I looked at a lot of things. They normally say ladies are interested in people and emotions, and gentlemen are interested in objects or in machines. So for me, it was a different thing altogether. I was always interested in people. I always thought no one should suffer without having somebody to help or assist them. That's when I thought nursing was going to be a best profession for me. It was going to be benefiting me and also rewarding because of nursing is a really rewarding profession. So since I joined in 2011, I joined before 2011, but professionally just being a student from 2011, I think from then I realized I did not make a mistake. When I enrolled in nursing, I never looked back and I thought this is what I would do, and I'm enjoying myself in nursing. But my grandmother
Okay.
played a huge role. She was, even at times when she comes back from work, she will share experiences and tell me about how much they saved patients' life, how much a patient came to the hospital in a critical state, and they would just make sure that these patients recover. At times, they lose some and they will gain some. But yeah, I was influenced by her over everything else. And then I had to see for myself, and I'm enjoying it.
Okay, I see that you're very passionate about about nursing. So
So I
I
can
know that.
safely, oh, sorry. So I was saying, so I can safely say I'm a nurse with a colleague who is trained.
Yes, I was also about to say that. I think they
Hmm,
go hand in hand. They go
of course,
together. You are called first, then you get trained.
yeah.
Yeah. So I see you are passionate about nursing, and I know that you have a long journey in nursing, like you said, that professionally you started training in 2011, and I know that you are also a candidate for a master's in nursing
Yes.
sciences. So what are your most proud accomplishments that you have achieved so far in your
Hmm.
career?
It's very hard to really give that one a grade. And thank you again for this question. I think the biggest of accomplishments that I've had in my nursing journey is seeing patients recover. I think that one
Okay.
is the best one of them all. Knowing that I make a difference in people's lives knowing that I'm part of a bigger picture of a process of having people, recover, getting their quality of life back in order. It's just the biggest accomplishment. So that happening, always motivates me and drives me into then doing more than what happens within the hospital walls. That's why then when I started doing my master's, I thought I should do something close to what I do every day, which is infection control in dialysis units. So then from then I thought this is the best I could go to. And then one of the moments where I thought, okay, here, this was very good. It was when I presented my study. I think it was 2-3 months back. I was presenting my study in a conference about my results and everything. And then I got position number 1. That was one of the proud moments. But the whole accolade, was not really about me. It was about what happens when I take care of patients. And then, yeah, it just always drives me. But yeah, over everything else, seeing patients recover and being part of the process is just what is always in the forefront for me and drives me.
Yeah, I can imagine. I'm sure it's fulfilling, even in your spirit, that someone just got better because you were caring for them.
Of course. There was this one client in 2018. I'll come to the room. She was in coma for a long time in ICU. ICU is an intensive critical care unit. So this client, when you get in the ward, she was not moving. She was just, being bathed on the bed and stuff. For those who have not been into an ICU setting. So this patient, I'll get in the ward, sing, do my work next to the patient, and be busy connecting her on the dialysis machine, which is a machine that helps with kidney recovery. And I would get there, greet the patient, even though I knew she was not going to respond because they say if someone is in coma, they can still hear the sounds. So I would hold her by hand and then greet her, call her by her name and tell her that things were going to get better, And then months went by. I think after 2 months, she was out of coma. So I walked in the ward. When I walked in there, trying to do the work that I do every day, and then she called me by my name, like, "Hi, Siyanda." And
Wow.
I was very shocked and I asked, how do you know I'm Siyanda? And then she told me, no, I know that one person who comes and sings next to me every time is Siyanda. So from the sound of the voice and what you always do, I realized this must be Siyanda. And, I used to, it really moved me. It really moved me and it changed my perspective altogether of how I should make sure I give my best when I take care of patients.
Yeah. I also heard you speak of nephrology, so I just wanted to know, is that one of the specialties? And also, if like one wants to study further, what specialties are available in nursing?
Okay, there is quite a lot. That's one thing interesting about nursing. Even now, when I still share some of my experiences with people in general public, they don't know about some of the specialties in nursing because they always think when you are a nurse, it's only about, bathing patients, giving them a bed pen or urinary pen, they always just associate it with more of that, because it's like something which is home-based. And then when you start telling people there is more to it, there is quite a lot. There is clinical, there is also non-clinical. I'll start with the non-clinical part of nursing because I think a lot of people are not really familiar with it, which is nursing education. Nurses can be educators, like teachers, but at varsity level, at college level, lecturers are nurse educators who are non-clinical. And there's also nursing management. Others, they will call it healthcare management services. There is that. Those two are non-clinical parts of nursing, whereby a nurse can be a manager, can be a CEO, or can be a minister, can be all these things. We've had Mantosha Ramsimang was one of the most prominent nurses to be Minister of Health. You see all those. And then there's now clinical. There's a lot of it. There's infection control nurse. There's psychiatric nurses who deals with patients with mental health problems, which is something we're really dealing with in the country. Even worldwide, it's a burden that everyone can see happening. There's nurses who are in occupational health, the ones who work in mining area and who works actually about employees and all that, making sure employees are safe. All those, there is critical care nurses who work in ICU, there is ER nurses, all those kind. And then there is me who comes in, this one is not very famous. In the country, some people don't really have much about it, which is nephrology nurses, right, or specialist. These are nurses who work with patients who are having kidney related problems. So that's what I do every day. I just deal with kidneys. And I've been doing this now for about 7 years. And I must say, I enjoy, I really, really enjoy. So what do these nephrology nurses do? We work in there are three departments in the kidney department. There is hemodialysis, and then there is peritoneal dialysis, and there is transplant. So nurses in nephrology comes from nephron, which are the most important structures of the kidney. So nephron is part of the kidney. It's the structures which are inside the kidney. There's a lot of them in there, but we'll dwell on that one day. So those are nurses who are dealing with kidneys, and they call the name of the department or the area of the specialty nephrology. So I work with that. I assist in cases where there is transplants, kidney transplants to be specific. I've seen a lot of them. I've seen the kidney and held it in my hand before. And we hope in the country people are going to start, donating their organs. At times when there is campaigns, I always campaign that people should form parts of these programs and campaigns where we say, let us donate our kidneys to make sure that we save these patients who are in hospitals, others are at home who are in need of our kidneys. So I work in that department, but more of it, I do dialysis, which is like a machine, like a fridge, the medium size of a fridge. I always do that, connecting on that machine. That machine acts as a substitute to what a kidney does in its function. So you connect it on the machine for about 4 to 6 hours, and then it does the work of the kidney, a part of the works of the kidney to clean the blood of a patient, and then a patient can walk going home as best as possible.
It seems like you're doing a very interesting job.
Of course. It's very interesting. It's very interesting. I'm loving. I don't think I would do
So
anything
I
else.
hope you guys are taking notes, ne? He's not just taking to me only because I'm really learning a lot already. And like he said, go and donate your organs.